7 little known warning signs that you may have SIBO by Dominic Hussey, functional medicine and osteopathic manual practitioner. SIBO, or small intestinal bacterial overgrowth, is characterised, as the name implies, by excessive bacteria in the small intestine. Typical symptoms of SIBO include bloating, gas and constipation and/or diarrhoea. If you thought that not having any of these symptoms meant you do not have SIBO, think again. There is a growing amount of evidence to show that SIBO can manifest with symptoms both inside and outside the gut. Listen on to find out more about some of the little known signs and symptoms of SIBO that I observe every day in my practice. Do you burp after meals? The majority of your friendly bacteria or microbiota should reside in your large intestine. Your small intestine should be virtually sterile. One of the main occupations of the microbiota is to break down fermentable carbohydrates found in foods like onions and garlic and produce valuable nutrients for your body as well as gases. When SIBO occurs, your microbiota overgrows from your large intestine to your small intestine. The microbiota now lives in your small intestine, continues to feed on these carbohydrates and produce gases. These gases become partially trapped in the small intestine, leading to typical bloating and gas. These gases can also be expelled upwards, causing burping. So if you find yourself burping a lot, especially after eating, this could be a symptom of SIBO. Do you experience fibromyalgia symptoms? Fibromyalgia symptoms include chronic pain and stiffness, especially across the upper back, neck and shoulders. There has been growing evidence to link fibromyalgia and SIBO. 2 studies published in the Annals of Rheumatic Disease found a direct correlation between subjects with fibromyalgia and SIBO. Do you get interstitial cystitis? Interstitial cystitis is a chronic condition causing bladder pressure, bladder pain and sometimes pelvic pain. A large number of people who suffer from interstitial cystitis have SIBO. In a study published in Digestive Diseases, researchers found 81% of 21 subjects with interstitial cystitis tested positive for SIBO. Are you lactose intolerant? People with lactose intolerance are unable to completely digest lactose. Lactose is a sugar found in milk. A small but significant amount of people with lactose intolerance also have SIBO. In a study published in the Saudi Arabia Journal of Gastroenterology, researchers found 18% of subjects with IBS were also lactose intolerant. Do you have chronic low iron and/or B12? You may have SIBO if you suffer from chronic low B12 or iron that does not increase with supplementation. It is thought that bacteria that have overgrown into the small intestine take up nutrients such as B12 and iron before they can be absorbed. Do you suffer from restless legs? Restless leg syndrome, RLS, is a condition in which you have an uncontrollable urge to move your legs. It typically occurs in the evenings while you're sitting or when you first lie down to go to bed. Recent research has found a strong association between IBS and restless leg syndrome. In a study published in 2012, researchers found that 25% of people with restless leg syndrome suffered from SIBO compared to 65% of controls. Do you have diabetes? If you have been diagnosed with diabetes and suffer from digestive symptoms, then you may have SIBO. A recent study observed that SIBO was present in 43% of diabetic patients with chronic diarrhoea, and 75% had a positive change in their symptoms after being treated with antibiotics. In conclusion, if you suffer from any of the above conditions with or without other digestive symptoms, then I suggest that it is worth looking into the possibility you may have SIBO. SIBO is diagnosed using a lactulose breath test. This video is for educational and informational purposes only and may not be construed as medical advice. The information is not intended to replace medical advice offered by physicians.